Hello everybody and welcome to another online lesson. You have joined us for my favourite topic in the whole medicine course, surgery in the industrial period. We're going to focus particularly in this lesson on anaesthetics, so the discovery of pain relief in surgery and how that's impacted on surgery. In a separate lesson, we'll look at antiseptics separately. Okay, so this topic is just fascinating, and really where you want to be with your mind on this one is what's a bigger impact? What has been the most important discovery in improving surgery? Is it pain relief? Is it anesthetic? Or is it going to be antiseptic? Which of those two things will you weigh up and argue would be the most important advance in this period? So we'll just focus on anesthetics and pain relief in this video, and by the time you're ready for your exams in year 11, this should be a topic that you are very confident on and very able to do an argument. Okay, so 1700 to 1900, we're right in the middle of the industrial period. All sorts goes on in this story. Okay, so this image that you can see gives a bit of an idea about the, I guess, types of surgery that might have been happening in the industrial period. Fairly basic, bit of amputating here and there, maybe taking a toe off. Nothing particularly mind-boggling in that. It seems to be just hacking away and off you go. By the end of this, and obviously as we go into the 20th century, the 1900s, we can see that surgery is going to advance so much that we're doing complex operations on the brain, on the heart, on the abdomen, open body, all sorts of incredible surgery. So just for some context as we go into this story today, remember the legacy of the Barber surgeon, this brutal barbarian, this brutal, horrible person who is going to hack you to bits, and the operations that they're going to do whilst cutting your hair possibly are very basic. So amputations, whipping off a limb or a wart or a tumour of some sort. They might take off some breast, I suppose, as well, but all of that is butchery, and the sort of reputation of the surgeon into this period carries on as this horrible experience. Okay, so by the end of it, we're going to be in a totally different world where surgeons are respected, and as we go into the 1900s especially, that is starting to change a little bit. And I suppose your job will be to try and understand, was that due to the progress in anesthetics, or was it antiseptic? Obviously both of them are hugely important. All right, so first thing to do in this lesson, in your book or on your Google Classroom, wherever you're doing this, if you're revising, if you are watching this because you missed a lesson, make sure you watch all of the attached videos that will be in your Google Classroom post as well. So pause the video, make a list of as many observations as you can about surgery, make some inferences, what you can see, what might the problems be, etc., etc. When you're ready, unpause the video and come back. Right, so hopefully you managed to spot the tools in the bottom of the picture are out to the elements. That's going to be getting all sorts of germs and things on it. This guy is being held down by several men. That shows you the pain he's in. You can see the anguish on his face. So we can probably imply from that or infer from that that they haven't got anesthetics yet. We can also see people in the background watching and learning, so possibly other surgeons. We can see people who've got, seems to be what looks like a pen or something in his mouth, making notes as this is happening. We're taking this guy's leg off. They seem to be in their outdoor clothes. So again, you could infer from that they don't change into surgery clothes. Lots and lots of things just to set up this little topic of where we're going. This is a scene, a typical scene of surgery in the industrial period at the beginning. Okay, some basic anesthetics in the terms of alcohol. The problem with alcohol is it just increases your heart rate. So when they cut into you, you're going to bleed and bleed to death probably. So we'll look at the different types of anesthetics until we settle on the biggest of the discoveries, which will be chloroform. All right, hopefully you picked out lots of obvious points from this picture here. Let's carry on. So before we do get into the big picture of the thing, it's important for you to understand there are three main issues with surgery in this period: pain, blood loss, and infection. Blood loss is obvious. You're cutting through arteries. You're going to start bleeding to death. Time is of the essence. These surgeons had to do things really, really quickly because, of course, there was no anesthetic to try and avoid the trauma and the pain for the patient, which meant that they were cutting through arteries and you will probably bleed to death. There's a very high likelihood that you would not survive surgery in this period. And, of course, pain and infection, Both crucial. This lesson is pain. You'll be able to watch the infection lesson on our website in the medicine section. All right, so the most common surgical treatments in this period, at the beginning of this period, are basic amputations. That's just always how it's been with the barber surgeon, right back to the Middle Ages. It was easy and it could be done fairly quickly, which, as we've talked about, was important for the patient. Accidents often happened, complications relating to tuberculosis, one of the bigger killers at the time. That's generally what was happening. Still some basic surgery. You want to be using language like basic surgery all the time, because when we are able to compare that to surgery in the 20th and 21st century, we change that basic to complex with examples, okay? So that would be good for question 3, the first medicine paper question, when it might say to you, explain one thing they did about surgery or thought or believed in the industrial period and one thing that was different in the modern period. Then your basic gist there is, as far as pain is concerned, basic to complex. Technology was basic. Technology today is obviously much better. So a really straightforward and hopefully quite a obvious way to think about that question 3. All right. So let's think about pain for a minute. Just think to yourself, have you in your life so far ever had some sort of anesthetic? Been to the dentist, hospital? Obviously, you're watching this, so you can't really answer, but just be thinking about that. And the fact is, probably, if you've been to hospital or had your teeth out, or most of us have, you've had some form of anesthetic. That's the impact and the legacy of this lesson right now, is that the anesthetics today, we even have anaesthetists who their sole job during an operation today is to monitor the anesthetics and the vitals of the patient, possibly one of the most important roles in surgery. And this is the legacy of today's discovery in this lesson. So far, how have we dealt with pain? Obviously, we've used alcohol. We know that. They use things like laudanum, some opium in the past. Generally speaking, though, nothing works. It's a horrendous experience for the patient, and that's why it needed to be really, really, really quick. All right, so let's think about this situation here. This picture, again, is quite brutal. There's obviously some form of surgery going on, people holding the patient down. So let's think about the summary of this yellow box. We would, obviously, in our history exam, we know time is a tight. We want to try and make sure we can make a point really quickly and concisely. So the summary of this yellow box here is that there are no anesthetics. Surgery had to be quick due to pain and blood loss, and surgery was basic. So that, hopefully, if you read that and look at the picture, sums up where we are now in the first 7 and a bit minutes of this video, this lesson. That's the situation where we are at the start of the period, and obviously by the end of the period we're going to make all sorts of progress. So let's work out now. Let's go on our little journey into how we've gone to basically the opposite of this summary that you're looking at on the screen. Pain was a couple of people who delved into trying to deal with the pain, because obviously they didn't want to hear the screams of the patient, did they? So Humphrey Davy was one of the first people who experimented with anaesthetics, and he used laughing gas as a painkiller, which was good, and it sort of worked. All right, you might have seen people on laughing gas today, gas and air it might be called. Sort of makes people a bit giddy, and definitely helps. So that definitely worked. The problem was when you're laughing and thrashing about, it's probably not ideal, is it, when you're having some complex surgery, if you're laughing and giggling. As you know, that sort of shakes the whole body. Also irritates the throat a little bit. So long-term laughing gas didn't really work. Then a guy called Robert Liston, who was known as the fastest surgeon in the West. He was famed for how fast and how quick he did operations. Some of the videos that you'll see on the Google Classroom, if you're watching this because you missed a lesson, are about Robert Liston. He is obviously known for his speed, and he had to be, but he's also known for I think a 200% mortality rate. So in one of his operations, he was so quick that he nicked the finger of one of his assistants, and 2 people died in one operation, as well as chopping off a man's unfortunates as he was going too quick. So there's lots of reasons why Liston's famous, but for this point here, he used ether. Ether worked. It was very, very good, but ether is like almost 100% alcohol, or super high alcohol content, which makes it very flammable. And in Victorian times, remember, gas lamps, oil lamps, a little spark flies on and that would be the end of that surgery. So ether was not a long-term thing either. Also, ether irritated the throat and caused the patients to thrash around a little bit. So now we come to the big discovery, the discovery that our exam board have decided to put in as the breakthrough, and that was James Simpson. So our next individual who discovered, in a funny way, if you like, you'll see why in a minute, the use of chloroform, that it knocked the patient out without any thrashing about. And that meant the surgeons could do really complex operations, really detailed stuff without the need for speed. Okay, and obviously that gives you a real good idea. If you've got all the time in the world, you can do these pretty complex things. He used chloroform on Queen Victoria's 7th or 8th child. And it worked, and she declared it quite brilliant, and therefore if the Queen uses it, then that gives it a little bit of credit as well. All right. However, there are problems with chloroform that we'll look at in a bit more detail in this lesson, more so to do with the dosage. If you didn't get quite enough, you woke up halfway through your surgery, which would have been a fright itself, and if you had too much, it killed you. So it wasn't perfect, but this is the anaesthetic that became the standard used as we approach the 20th century. All right, so let's get a bit of backstory on these things in your notes. Just make sure that you've summarised what we've just said, maybe with a little bit of dual coding, some pictures. Just summarise what's in this orange box as to the problems of the three initial early anaesthetics. We talk through them fairly easily, but just make sure you summarize that. And then we'll have a little focus on this very quickly. Source C, a girl called Hannah Greener, 13 or 14 she was. She had an ingrown toenail and she died. Too much chloroform. The dosage wasn't right. So simple operations have killed this girl. Now, you can see from this picture, she's obviously wealthy, so it doesn't really matter, wealthy or poor. The dosage of chloroform was the problem. All right, so we need to get a solution to that, which, of course, as with always, when there's a problem, someone comes up with a solution. And interestingly, the solution is from someone we've met before, Dr. John Snow from the cholera story. He created an inhaler where you sort of put enough dosage in that was enough for a child or a grown man, and they warmed it up with their hands, and that released fumes rather than taking a full-blown inhalation of the chloroform, which stopped the heart in many, many cases. So far, we can see why there might be a tiny little bit of opposition to the chloroform, and the early attempts at pain relief fairly successful, but what it comes down to really is chloroform. And this is going to be one of the arguments that you're going to use, and you'll see why this is important in a minute, as it led to what we call the black period of surgery, where you might say that antiseptics are a much more important discovery. But I'll get onto that in a minute, and in the antiseptic video, we'll talk lots about that. And this is the kind of analytical language you want to be using in your exam question, in the essay, when you're saying the chloroform is great, but it didn't stop people dying. In fact, it led to more and more people dying in the black period of surgery, which we'll explain in a minute. So who is this guy? James Simpson. There he is. He's up in Edinburgh. If you go up to Edinburgh and you're walking on the high street or one of the main streets, he's not hard to find behind all the trees, but clearly he's got a statue, and he's got a statue because he's done something incredibly important, and that is the first real good use of anaesthetic. He's taken pain out of surgery, which is just phenomenal. Yes, as we know, there's a few tragedies of people who've died from dosages, but once we sort the dosage problem with John Snow's inhaler, problem solved. Pain, we can now do incredibly complex surgery that we couldn't do before, and that comes down to this guy, James Simpson. So how it all happened really is he had a little party with his mates. Probably there's more to it than this, but for where we are in this story, he got his mates around, wealthy people, had a bit of chloroform, knocked it over, everyone passed out, thought it was a great hilarity, great fun, but what they had accidentally sort of figured out was that chloroform knocks people out. And James Simpson then thought, well, I wonder if we could use that in surgery, and the rest, as they say, is history. So that's a bit of a sort of side story. There's not that much necessarily to worry about on this bit, but they sniffed it, they laughed, and they passed out. So that's the chloroform and how it is. Now, what we want to look at in the rest of this lesson, and the actual detail that you'd need to include, is what it's led to, what it's important for, what is its impact, not so much the story of how it was discovered. So the strengths and the weaknesses of chloroform, okay? You can see here, do your notes on this, either good and bad, like a little smiley face, sad face you can see on the screen, or just 2 paragraphs. Maybe, again, a little bit of dual coding, some pictures will help with this. But the good thing about chloroform and the stuff you're going to talk about, why it was such progress, is it knocks the patient out, allowing for slow and pain-free surgery. Remember that word, complex surgery? You definitely want to be talking about that. It also raised the confidence that surgery would be painless, so therefore more people were willing to have surgery. Remember the years before that, the confidence in surgeons and barber surgeons was low. These people were seen as violent, as butchers. No one wanted surgery, and the chance that you'd die was very high, but the chance of pain was guaranteed. So now people are starting to think, okay, well, pain relief, I might have a little bit of surgery. The patients would be still, meaning you could do these really serious, complex operations without them wriggling all over the place. And as we've talked about, Queen Victoria used it for childbirth, which just helped to sort of legitimize it a little bit. If it's good enough for the Queen, then it's good enough for everyone else, if you could afford it, of course. So this bit that's now in red is just really categorize and bring your attention to it, why it's important. Deeper, longer, complex surgery. I cannot really emphasize that point anymore. That's the big difference from earlier surgery or surgery in the Middle Ages to surgery now, is the complexity of it. And the reason why that's possible is because of the pain relief. So we can do extreme things, stomach, brain, heart, who knows, as we go into the 21st century and 20th century, because the patient is still happy days. All right. But, and this is the big but, and this is where you might say in your essay, however, or on the other hand, the reason why antiseptic discovery was more important was due to the fact that the black period of surgery occurred because chloroform was so good. So the reason for that, okay, and we obviously talk about this in class, but if you're watching this because you missed the lesson, then it's important just to make this note now. And if you're watching this because you're revising year 11, I'm absolutely sure this is one topic that just needs a nice light touch. The black period of surgery is the patient is on the table, unconscious for hours at a time. Lovely, delicate, complex surgery going on. But of course, they are open to the elements of the air. Now, by this point, we have not yet discovered the germ theory, all right, which is basically important in this thing, because what we would then see is that there are germs in the air. If the patient is lying on the table for a long time with their guts and their abdomen open, or their heart or their chest, then those germs are falling into the patient and leading to infections, which becomes the biggest killer and an almost certain guarantee that you will die in surgery. So the black period of surgery is because of chloroform, but really it's because of the germs in the air, and the body and the patient is open to it for much longer. There's a big negative, and when we solve the problem of infection, then maybe chloroform can come to light and we get the credit there. But for me personally, without the antiseptic, without solving infection, it doesn't matter how long the patient is lying there. It doesn't matter how much still they were. If they're going to get death from infection anyway, it doesn't matter. So that's kind of where I would be going on that story. So the negative of it still is that there's a lot of this harsh reputation for the surgeons as being butchers. People didn't trust them. They didn't like them. The chemical chloroform affects the heart. That's what caused people to die, especially young people. So the reason why it affected young people more is because they were probably a little bit braver. So they took a deeper inhalation of the chloroform, which stopped the heart. Basically, the dosage problem. People opposed it on religious grounds as well. So childbirth was, in religious terms, supposed to be painful. They wanted it to remind you Jesus' death and all of that stuff. And from his death to the sort of magnificence of childbirth, you were supposed to remember Jesus' sacrifice, or all those kind of quite crazy views of religious people at the time. So you would be expected to go and have childbirth without anaesthetic. The dosage, as we've talked about, could kill you if you had too much, and not enough, you woke up halfway through the surgery. Jon Snow has invented this chloroform inhaler, which is going to help with that significantly. As we've talked about, it allowed people to not die. So we've solved the problems fairly quickly of the anaesthetic, but still people did die. And men sort of were taught or believed at the time, this is getting towards the suffragist movement, some of that things we've talked about in Key Stage 3, where there was an attitude about men supposed to be men, and any man who relies on anaesthetic would probably be seen as a bit soft. So a lot of men might have chosen not to have anaesthetic. Today, it'd be crazy. If you went to hospital and you'd be like, no, I will not have any anaesthetic, please, because I'm a man. I don't know. I'm not sure anyone would even take you seriously. They might put you in a mental asylum. But that is how it was at the time. Men were expected to be seen as being men. So in all, that is a fairly quick, straightforward lesson, really. It would obviously fit in with the antiseptic as a lesson on surgery, full stop. But I just thought it'd be useful to do a separate video and a separate lesson for our website, just to get your head around this one, and then antiseptic. And remember at the end of all that to put it together, and you should be able to write a very strong argumentative language. All right. And as we've talked about Hannah Green as just a good example of a girl who died because she had too much when she had a ingrown toenail out. With the exam board, they like facts. They like little bits of evidence like that. So if we can get a name in there like Hannah Greener or James Simpson or Robert Liston, any of those kind of things are going to help. So this is a little overview of the times in this period. Again, people often worry and complain in history about all the dates you've got to remember. It's not a case of remembering the dates. As long as you're in the right period, then we're okay. But we can see that James Simpson was 1847, so that's quite a time before the germ theory. It's a little bit before John Snow discovers cholera in 1854, and a little bit before Nightingale's work in the hospitals of Britain when she comes home from the Crimea. But we're starting to see that there. So it's quite clear, to take a bit of pressure off and give them a little bit of credit here. The black period of surgery, nobody knew. Nobody knew about germs, so it's probably really hard to blame Simpson for this, but it is a fact that because these patients were unconscious for a long time, it allowed the germs to fall into these open wounds. So that is the gist of it. As a little revision exercise, which I think might be quite nice, is turn these dates and these events and everything from this lesson into a little timeline. You can do this fairly quickly with some pictures, with some images that relate to the words, bit of chill coding maybe, just to get your head around this. And then you'll be ready to move on to the antiseptic lesson. All right. If you do have any questions on this, please ask your teacher. I think it's quite a straightforward topic. Your job is just to try and make sure you can tell this story. You can build this up of all the positives of chloroform, why it's so good, why is it progress, but then also you've got to be aware a little bit of that negative connotations. As always, every lesson is on stchistory.com. Thank you very much for listening. Hopefully this was useful, and we will see you for the next video. Thank you very much, and goodbye.